welcome to another episode of the ICC Podcast. I am Sela Kantaeni and thank you for joining us. It's Friday, 28th August 2026. In this week's episode, the Commission took its awareness campaign to Kamuzu Central Hospital and Zomba Central Hospital, as well as Chiradzulu, Thyolo and Mulanje district hospitals. This is so because hospital personnel are among our key stakeholders and play an important role in the Commission's mandate of investigating complaints against police. It is therefore important that they are aware of the existence of the Commission, its mandate, and the important role they play in supporting our work. To give us a summary of the campaign and its importance, our Public Relations Officer caught up with the officials, beginning with the ICC Principal Civic Education Officer, Rose Walia.
Tell us, how has it been?
So far, we might say it has been successful because we have gone to about 4 hospitals. That's 4 in the Southern Region and 1 in Central Region, KCH. Through our interaction with medical personnel, they have received it well. There's positivity. Some of them, they didn't know about ICC, and our visit has been an eye-opener to them, but also accepting that they really play a vital role in the investigation of ICC. We believe that when our investigators are going to hospitals, they will not meet any problems. That's the mentioned hospitals that we have gone to.
What is the main objective of visiting these hospitals?
Our main objective was to give awareness to health personnel. As you are aware that there are other cases that ICC receive. In order for us to have medical reports, we find them at the hospital. In order for us to have reports about rape and defilement, these cases are referred to the hospital. So it's only medical personnel who can confirm death. It's only medical personnel who can confirm that really there was rape and also maybe a child was defiled. And the health personnel also gives a report on maybe physical assault. So the main goal was to meet medical personnel so that we build a good relationship, so that our investigators, when they go in these hospitals, they should not meet any problems when maybe they are requesting for medical reports. Another thing is for health personnel to involve ICC officials in other procedures, more especially autopsy. Our going to hospitals is to give awareness to medical personnel so that at any time when they feel like they suspect that the death that they are conducting an autopsy on was caused by a misconduct of a police officer, they can inform us. So we thought that us going to them is like giving them the information that they can also come to ICC, so that together we work together in order to make sure that our police officers are accountable for their actions. At the end of the day, they are professional.
During the plenary, when they asked the questions, they presented they made their comments. On top of that, they also made suggestions suggesting how, as the Commission, can move forward to reach out to the people, for example, to expand its awareness campaign, expanding its mandate. Those are some of the suggestions coming from the conversations that we had. What does that tell you?
Actually, it tells us that they have received the message positively, and actually they feel that ICC is an institution that can really help the community. That's why they have made a number of suggestions to say, even though ICC is planning to open its branches in 6 police regions, but most of health personnel, they feel that is not enough, but rather we should go in each and every district. So they also suggested to say we have to go to communities, because the community, people from the community, they are not very aware of ICC. That completely shows that they were able to follow the presentation. They have received the message very positively, and they are willing to help, but also to give an advice how we can go forward. So to us, that is also a plus to us to say, okay, fine. It means we will really be moving together with the health personnel.
Thank you very much.
Welcome.
My name is Martin Mindano Malunga. I'm working as a senior clinical officer here at Mulanje Central Hospital.
How do you describe the 2-hour session?
Well, let's start with defining the ICC, which stands for Independent Complaints Commission. The 2 hours have been an eye-opener to us as a Mulanje Central Hospital, because really oftentimes we have challenging cases, and at times we have documents which are supposed to be submitted to those who called for those ones. But with the discussions, we have discussed that the ICC would also love to assist those poor communities, those poor complainants. We should be able to be discussing with the authorities how we could try to release these informations as duplicates.
After all, it's about building a relationship between the hospital and the commissioner. Moving forward after this awareness meeting, how do you look at the relationship now between the hospital and the commission?
The relationship should be very good, and even after this session, we need also to brief our colleagues what we have learned here, because it will also be an eye-opener to them how we should be handling these cases. And we have to be open as we normally do, and we have also to be ethical, because we are professionals and we are abide by laws, so we needed to do things according to our mandate.
Apart from maybe getting some knowledge or insights about the commission's need and your profession as an individual now, you might have also be a beneficiary of this session.
Yeah, I've worked in the hospital field for several years, and this time around interacting with the ICC is really a great eye-opener, because sometimes we have really tricky cases where you are stuck. How are you going to go about these cases? And with ICC, we are double sure that those oppressed will be assisted properly, and the law or justice must prevail.
Finally, your final remark or comment?
It has been a short interaction. The presentation is detailed, and you have seen we have curtailed so many questions we were having. We hope we should be doing the reviews, and as you heard from the questionings, that sometimes we needed to call you when we are doing a postmortem, but you are based in Lilongwe. So it's also our plea, our request that we should fasten some offices to be, for example, closed in Blantyre, and in the long run, maybe they have to be devolved down into the district assemblies, so that it should be a walk-in, not necessarily waiting for so many hours, because other people with their cultures, they don't want to have dead bodies being in the mortuary for quite long. So the time has been so short, but really it has been an eye-opener.
And it is also evident from the questions that we have received from the participants, others even giving their suggestions on how we should move forward. What does that tell you?
It just means that maybe if we could have a whole day discussing these issues, because even when you will be factoring in some other issues in your policies to come, maybe we need also to interact. You need also to involve the medical professionals, so that it should be a collective thing in the future.
Thank you very much.
Welcome. Thank you.
And that's all we had for you in this week's episode of the ICC podcast. As the discussion has highlighted, hospital workers remain an important stakeholder who make our work of serving the people with justice possible. Remember, if you have a complaint against the police, call our toll-free number 4314 and lodge your complaint. I am Sela Kantayeni. Thank you for listening, and goodbye.